Watch out for your health. This is a big deal. The American Cancer Society changing its advice on when women should start getting mammograms.
We found out that the updated guidelines recommend yearly breast cancer screening for average risk women starting at age 45 instead of 40, and then switching to every other year at age 55. Our Amy Frazier went to a local oncologist and the Susan G. Komen Foundation for some reaction to this updated advice. And it seems like this kind of keeps changing a lot.
Yeah, it really does. So that can get confusing for people. Bottom line, though, everyone seems to agree it's important to have a personal conversation with your doctor about when it's best for you to start screening for breast cancer. Keeping that in mind, though, there's both some support and concern about the new guidelines for you to consider. For the first time in 12 years, the American Cancer Society is updating its guidelines for when women should get mammograms. The new recommendation says women with an average risk of breast cancer should begin yearly mammograms at age 45. It also says women should be able to start the screening as early as 40 if they want to. I went to the Providence Cancer Center to ask Dr. Allison Conlon about the new recommendations.
I think it's all about that a younger woman is less likely to get breast cancer, and a younger woman is a lot more likely to have denser breasts, and it's going to be more difficult to use that mammogram. That's not true about every woman. That's why asking your doctor, how is my risk factor? How is my family history factor into this?
The American Cancer Society also points out that by age 45, the benefits of mammograms outweigh the potential harms, like false positives that come with more tests, pain, and anxiety. I also went to Susan G. Komen, Oregon, and Southwest Washington to ask about the new guidelines.
It certainly has pause for Komen. We firmly believe that early detection and all the tools that are necessary for early detection is paramount for women.
I found out Susan G. Komen still supports mammograms for women starting at age 40. Are you concerned at how this could impact insurance and what insurance covers when?
We do have concerns about private and public insurers that may look at this as a mandate that these resources or screening tools shouldn't be available to certain ages.
In the new guidelines, the American Cancer Society also says breast exams, either from a doctor or self-exams, are no longer recommended, saying research has not found a clear benefit.
We do know that women perhaps living in rural communities or at an age where mammography may not be available, clinical breast exams also continue to be a very important tool that's non-invasive, very quick to do, and we feel necessary.
Again, no matter what the guidelines are, medical experts say it's important to talk to your doctor about what's best for you. And I have to tell you, everyone also seems to agree that for women, that conversation with your doctor should begin at age 40.
And depending on what your family history is, that could be even earlier. My mom had breast cancer, so I started that conversation at 30.
Yep.
So, I mean, that's something that is very dependent on your own situation.
Yeah, real personal to you.
Thank you for breaking that down, because that seems to be changing a lot. So folks can go to coin.com to read up on that again. Thanks, Amy.